Welcome to Lunch with Legacy Leaders, a weekly talk show with local and national thought leaders on issues impacting the Black community. Now introducing our host, Ms. Anne Marie Sorrell.
Good afternoon and welcome to another episode of Lunch with Legacy Leaders. I am your host, Anne Marie Sorrell, President and CEO of the Mosaic Group. We're super excited about our conversation today, but before we get started, we'd like to thank our sponsors, Broward Health, AARP, the Florida Lottery, and the African American Black Alzheimer's Disease Initiative at the John P. Hussman Institute for Human Genomics, University of Miami Miller School of Medicine. If you or someone you know has experienced memory loss or have memory problems, please contact their research team for more information at 877-686-6444. So today I'd like to welcome our special guest, Dr. Margaret Lott, who is an internal medicine and pediatrics specialist at Broward Health. Welcome, Dr. Lott. How are you?
Hello, I'm good. How are you? Thank you for having me.
Oh, thank you for being here. So I understand that you're practicing in Pompano Beach area, correct?
I do, yes. So as you stated, I'm an internal medicine pediatric trained physician. I work with Broward Health with the Department of Community Health Services out of the Pompano Beach area. I was trained down in Miami at Jackson, but I am a Florida native as well.
Awesome. Well, we will dive right into our conversation because we have a lot to cover in a very short time. We want to be mindful of your time, as we know getting you or any physician is like a privilege. So one of the hot topics, as we know, with this pandemic that's on everybody's mind is vaccinations. We have seniors that have been prioritized, as well as healthcare workers for vaccinations. And the rest of the country and population is wondering, when am I going to get my vaccination? What are the risks? Should I get the vaccination? There's definitely, it's definitely out there that Black communities are disproportionately not getting vaccinations for a variation of different reasons. So we definitely want to dive into that conversation to, just kind of see if we can clear the air on what are some of the myths and really just get the facts about the vaccinations. So before we dive in, though, as we, Lunch with Legacy Leaders, it's very important for us to really highlight our leaders in our community. So briefly, if you want to just kind of share your journey with us of becoming the physician that you are with the Broward Health medical team.
Yeah, so as I stated, I was born and raised in West Palm Beach, Florida, graduated from Seminole Ridge. And after graduating, I went to University of Pittsburgh for undergrad and medical school. Then I decided to come back down to warmer weather. So I trained at Jackson Memorial Hospital. I was very fortunate to go straight through my training. And right after, I took a job with Community Health Services, which primarily provides care for patients who are on Medicare or Medicaid, who may not have insurance. So I find that very rewarding. And I see adults and children in the primary care setting.
Awesome. Well, thank you for sharing with us and congratulations on everything. And I live in West Palm Beach, so
okay.
Palm Beachin', yes. So as you're aware, number one, healthcare climate has been crazy since the pandemic. And I just want to know how you and your team members are coping, first of all, with just everything that's happening, especially on your end. I don't think we get too often to hear from physicians what you're seeing on the inside.
Yeah. So as you can imagine, it has been a bit challenging during the pandemic. Just the sheer duration of the pandemic has led to a lot of burnout with healthcare providers. Just a balance between caring for our patients and then trying to keep ourselves and our families safe. So that has been interesting and challenging, but it's also stretched us and helped us grow in different ways. We have started to implement more telehealth which has been very helpful for patients as well as for protecting us. And we do have a good.
I think he broke up a little bit.
Sorry. So yeah, we do have a good amount of personal protective equipment.
Okay, awesome. So as we were just discussing, okay, sorry about that. As we were just discussing, Black and Brown communities have experienced severe and fatal impacts of COVID-19. Vaccinations are now available to seniors, and I would assume now with the Johnson & Johnson vaccine coming on board soon, that we'll have more available to the open population. However, there's been challenges of administering these vaccinations to communities of colors, whether it's access to the vaccines, fear, distrust, whatever that may be. What are you seeing firsthand as far as the challenges, and what are you hearing and experiences as to why our communities are not getting the vaccinations in the numbers that we should?
Yeah, so you hit the nail on the head. I think the two primary issues with the vaccine are both access and hesitancy. So access, as we know, communities of color are often the last to receive resources, which is why we often refer to them as under-resourced areas. But I believe the events of 2020, such as the Black Lives Matter movement and the COVID-19 disparities, has really highlighted some of those concerns and has caused us to put a focus on getting access to vaccination. So we've seen things like pop-up vaccine sites near communities of color and partnering with churches and community organizations to make sure that these vulnerable populations have access to the vaccine. Now, when it comes to fear, when it comes to hesitancy, that's mostly because of fear and mistrust. And that is understandable given the history of African American people in this country. So we're trying to overcome that through education and reassuring African Americans that the vaccine has been studied and shown to be safe and effective through platforms such as this.
Absolutely. So let's dive into some of the concerns. There are definitely questions that people have on their mind, and I'd love for you to just take a moment to share with us. I think this is good education for anyone who's listening, and they can, please, everyone who is listening, please share this with your neighbors and friends and colleagues, so that way we can all be informed about our healthcare decisions. So, one of the primary questions that come up is, can a vaccine make the person receiving the vaccine itself sick with COVID-19, and can it make those around them sick with COVID-19?
Yeah, so the COVID-19 vaccine works very similar to all other vaccines in that it causes the body to stimulate an immune response that subsequently protects the individual upon exposure to the vaccine. It uses a different type of technology, mRNA technology, but it does not infect the person with the live virus or even an inactivated virus. And because of that, it is not thought to make someone sick with the coronavirus or cause them to be infectious to other people. Now, in the process of generating the immune response, the body can have some symptoms. So people may experience things like fatigue, chill, headache, but this is usually mild and transient. It lasts for about 1 to 3 days, and it does not signal that someone has been infected with COVID-19.
Okay. So what about after getting the vaccine? Can a person still test positive for COVID-19?
Yeah, so because the vaccine is not infecting someone with the virus or giving them the live virus, it is very unlikely that they will subsequently test positive for the COVID-19 infection. Now, there is a caveat in that it does take about 2 to 3 weeks to build immunity after receiving a vaccine. And there's also an incubation period. So if someone was exposed to the virus, it takes about 2 to 14 days for them to develop symptoms. So if someone was exposed just before, just after receiving the vaccine, they may subsequently test positive, but that is more from a community exposure and not from the actual vaccine itself.
Okay. Now, if they do test positive, let's just say in an instance, someone unknowingly got exposed and they went in for their vaccine the next day or the next couple of days, and they start developing the symptoms, does this vaccine do any of these vaccines lower the risk of some of the long-term impacts that COVID has been having on people?
Yeah, so once someone develops the immunity that comes from the vaccine, the studies have shown that they are 100% effective in protecting against severe cases of COVID-19, and they're about 95% effective in protecting against the coronavirus itself. So it would be beneficial to get the vaccine.
Okay. Now, if someone has already had COVID-19, they've recovered, do they still need to get the COVID-19 vaccination?
Yeah, it would be a good idea for them to still get the COVID-19 vaccine. So when someone is infected with coronavirus, they naturally generate antibodies. Those antibodies are thought to last for about 3 months or 90 days before kind of tapering off. And they have protection towards that particular variant that they were infected with, or very similar variants. And as we have heard on the news, there's many variants and there's novel variants. So vaccine generates a bit more robust immune response, and it is protective against most, if not variants. So it would be beneficial to still get the vaccine if they have had coronavirus. Now, in terms of timing, they can get the vaccine right away, or they can consider waiting that 3-month or 90-day window until their natural antibodies kind of taper off before getting the coronavirus vaccine.
Okay. Now, you brought up the new variants, and there's the UK variant, which Florida has, I think, was trending at the highest number of cases. Then recently, we just also was reported in Florida that we also, in South Florida, as a matter of fact, that we also now have the, I believe it was the South African variant, or was the Brazilian variant, one of them. So there's the Brazilian variant, there's the South African variant. And then before that, there was the report about a week ago saying that the California and the UK variant had kind of mutated together. So what does this all mean, and what does it mean for the vaccination? Are these vaccines, especially now that there's 3, once the Johnson & Johnson is finalized by the FDA, there's going to be 3 vaccines. How does someone know which one to take? How do we know which one is the most effective against these new variants?
Yeah, so it's important to note that all viruses have variations. Viruses naturally mutate, and as a result, we can classify each virus. That's why for the flu vaccine, we get it every year, because each year it protects us against the most prominent strains that were available in the previous year. So it's not surprising that the coronavirus has variants and that it is mutating. That's to be expected. But the concern is that some of these variants have been shown to be a bit more infectious, which can lead to more people being infected in the community. The good thing is that the Pfizer and the Moderna vaccines, which are the vaccines that are available to date, are thought to be protective against the new variants. So either one would be a good idea. Studies are still out as to whether the AstraZeneca is protective against all of the variants as well.
Awesome. That's good to know. Now, this one's a little different question, but will the COVID vaccination alter a recipient's DNA?
Yeah. So to answer that, we have to talk a little bit about how the vaccine worked. So I said earlier that the vaccine uses mRNA technology. So basically what that means is it inserts a small piece of mRNA that is then turned into a protein in the cell. And that protein is what causes the body to have an immune response that protects us. So when that mRNA is converted to a protein, it is degraded immediately. It does not linger in the cell or integrate to our own genome. In addition, the location in the cell where the mRNA is converted to the protein is in the ribosomes, and the location of DNA in the cell is in the nucleus. So these are taking place in two completely different parts of the cell, and the mRNA and our own innate DNA is not coming into contact with each other. So it is very unlikely that the COVID vaccines will alter DNA.
Thank you for that answer. Now, for mothers that are pregnant or mothers to be that are pregnant, or if someone is of the childbearing age and they're considering getting pregnant anytime in the near future or in the future, is it okay for them to get the vaccination?
Yeah, so at this time, it is thought to be safe for women who are interested in conceiving in the near future to have COVID-19 vaccine. There's no evidence to suggest that it would affect fertility in any way. And some women who were in the original Pfizer trials did subsequently become pregnant after receiving the vaccine. For women who are currently pregnant, I would encourage them to talk with their OBGYN about risks and benefits of the vaccine.
Okay, well, that's a good point. What can you, or where can people find more information about the various vaccines, the concerns that they may have, answers for those concerns? Where do they go for this information?
Yeah. So my organization, Broward Health, we do have COVID-19 information, and you can also register for the vaccine on our website, and that's browardhealth.org. You can also go to the CDC, which has quite a bit of information, as well as the Florida Department of Health website. So we are currently vaccinating individuals who are over 65 and under 65 who may be high risk, as well as healthcare workers. And that's browardhealth.org.
Okay. And is it easy? Is it an easy process? Because, you know, there's been like a bunch of news coverage where people have to call 20 times different numbers to try to get a vaccine, or they have to wake up at 4 a.m. to get in line for the vaccine line that opens at 6 a.m. And, you know, and there's been, you know, quite a bit of frustration over the last several weeks with this. So can you tell us the process? Like, somebody, do they just go to the website and just click a button and register?
Yeah, so it's been a pretty seamless process, at least with our organization. I know in the beginning, as with many things, it was, there were a few hiccups, but someone can, there's a number that they can call on the website, or they can get the vaccine link at the top of the page to register, and someone will call them and set up an appointment. I have at the vaccination sites, and the wait times have been 10 minutes or less. People have been moving in and out, which is great. It really runs well. So I think we resolved some of those hiccups that were happening in the beginning of the vaccine campaign.
That is wonderful news. That's wonderful news. So my kind of last question And you've given a lot of good information here today, and you've definitely told us where we can go find more information. But sometimes we just like to hear it from the source of, especially someone who may have a elderly parent or grandparent that is really trying to convince them to get this vaccine. What just, advice can you give them to encourage their loved ones to get the vaccine? Or if they're listening themselves.
Yeah, so I would just reassure them that the vaccines have been studied, they're in rigorous trials, and they have had to show data that shows that the vaccine is both safe and effective. Other than the mild side effects that people have that are transient after receiving the vaccine, the is you and your loved one will be protected from this very dangerous virus. And more people that are vaccinated within our community, the safer it will be, especially for those who are high risk and vulnerable among us. So I would really encourage them to talk with their friends, their family, about the benefits of getting the vaccine and to consider being vaccinated to protect themselves, their loved ones, and their community.
Absolutely. And I know we're talking about vaccinations, but I do want to just kind of get your take, because I do feel like in some cases, as people have gotten COVID fatigue, there's just still quite a few people that are just kind of, out living their best lives. And you're on the front line. So do you have anything to say to just kind of remind and encourage people that we're still in a pandemic?
Yes. So there is a light at the end of the tunnel. I know it's been a really long road. It has been a long entire year, but basics can still work to protect you and your loved ones before and after you receive the COVID vaccine. So things such as hand washing, wearing your mask when indoors or when in crowded places. This has been shown to reduce transmission of the virus and to save lives. So I would really encourage people to just keep on pushing, hold on just a little while longer, and stay safe while we get the rest of this pandemic.
Absolutely. Well, thank you so much, Dr. Lott. This has been a wealth of information, and I hope that everyone who is listening, that this information helps you, helps your family, helps your neighbor who may not be on social media, but you can go and sure enough share these tips with them and help answer their concerns and ease their concerns and ensure that they get that vaccination, especially if they're over the age of 65. Dr. Lott, stay with us for just a moment as we go through some announcements. We want to thank you again, our sponsors, Broward Health, AARP, and the Florida Lottery, as well as the African American Black Alzheimer's Disease Initiative at the John P. Hussman Institute for Human Genomics, University of Miami Miller School of Medicine. Our power issue for nominations are open. So if you know of a Black professional who is influential and just doing an amazing job in their career and the community, please nominate them. And it can be someone from Broward, Miami-Dade, or Palm Beach County. And you can nominate them at miamediagroup.com/nominations. Also, make sure you check out our Black History Month issue that is currently on the website as well. We look forward to you continuing to join us every week. Please remember to share this video. And again, thank you, Dr. Lott, for your time today. Did you have any last words for our audience?
Thank you. Thank you for having me.
No problem. Thank you. So everyone, please make sure you tune in next Thursday at noon.